So, without further ado, Jason, please feel free to tell us a little bit about your practice and we can get right into the workshop.
Okay. Well, thank you all for being here today. I'm really excited to share this presentation with you. So my name is Jason Terry, and I'll go ahead and start the presentation. And Destiny, just let me know if you can see the screen.
Yes, I can see it. Can everybody see the Calm Your Pain workshop PowerPoint? Yeah. Okay. Cool.
I can't see you guys when I'm presenting, unfortunately. So all I can see is what you're seeing. So yes, my name is Jason Terrian, and I am a doctor of physical therapy. I specialize in the treatment of uh, people who experience chronic pain. I've been in this field for going on 9 years. For the first few years of my career in treating pain, I was working in an outpatient physical therapy clinic, and for the past 5+ years, I've been working in a pain management clinic, which is not a place that you'd find a lot of physical therapists. PTs tend to work in outpatient clinics or hospitals, but not often in pain management. So that's a little bit about me. I'm also a health and well-being coach, and I view that in a more of a holistic lens, and that allows me to be able to work with folks outside of the state of Tennessee and offer them some of the same things that I might offer a patient who was seeing me in the clinic. I'll go ahead and get started here. So the first thing I want to say is I'm sorry. And I'm sorry can mean two things. The first meaning of this is if you're here today, there's a pretty good chance that you've been hurting for a long time and that up to this point, you have had less than satisfactory results working with the healthcare industry or with other providers along the way. So I'm sorry on behalf of healthcare that we haven't done better to help you to up to this point. I'm sorry also means an offering of sympathy. And I've seen firsthand with people in my life, but also with my patients, the really devastating effects of experiencing chronic pain and how it affects one's quality of life, how one enjoys or is able, if they're able to enjoy their day-to-day experiences, the meaningful activities of their life, having to say no to events that you would otherwise say yes to if you hurt less, be able to travel, social engagements, that sort of thing. So thank you for being here, and I'm really sorry that pain has been such a significant has had such an impact on your life that you would need to come to a workshop like this. So the plan for today is we're going to start by just talking about some of the challenges that I've become familiar with in working with people who experience chronic pain. Some of the challenges that people encounter in the healthcare system and otherwise. I'd like to present a new way forward, a new path, a new way of moving towards more partnership with one's body. We'll talk about what calming pain means and even do a little practice together to help calm the pain, or at least attempt to do so. We'll talk about what does it mean to build the body up and what are some important things to consider in doing so, how to be a partner to one's body and how to listen to it so that you're not flaring up your symptoms along the way. Um, we'll hopefully have a little bit of time towards the end to integrate some of the things that you've learned today. I might offer to take the group or an individual through a goal setting exercise. And at the very end, I'd like to share some additional resources that you might find important or valuable, including ways of working together or other resources that exist out there to help you understand and better care for your body and your pain. So with chronic pain, we have a bit of a navigation problem, is how I might put that. For many, over the course of their experience hurting, they might try one or more of these different directions. So, for example, you might try to push through the pain or ignore it. And that's pretty common amongst folks that I see. They try for long durations to just live with it or push through it and not let it stop them or limit them with their day-to-day lives or their important activities of their life, like the way that they work or the way that they do things in and around the house, travel, even exercise. They try to push through the pain. And for reasons that may be obvious, that doesn't work in the long run. Eventually, the pain gets worse and becomes more and more limiting. You can try treating yourself, and that can mean anything from over the counter pain medication to heating pads or um, other forms of heat related therapy, like, hot showers, hot tub, if you have access to one. You might try different topical ointments or things like that. For many of you, you've likely at some point in time gone through the healthcare system, maybe starting off with a primary care provider, um, like your primary care doctor, and letting them know that you hurt, and then they might refer you to perhaps a physical therapist or an orthopedist. They might ask you to get some imaging tests done, like X-ray or MRI, and that for many might lead to some success or some helpfulness. Maybe you find a really great physical therapist or doctor to help you with a procedure or some kind of surgery. But for many, from my experience working in particularly in pain management, people they go this route and it either doesn't help or in many cases makes things worse, including the physical therapy. As well intended as it might be, PT can often flare up people's symptoms. We're going to talk about that a lot today. Alternative and complementary approaches that might be what you would perhaps put into the category of holistic or integrative care. So that might mean dry needling, acupuncture, um, seeing a variety of other alternative body workers, so chiropractors, different kinds of massage therapy. You might look at your diet or your nutrition and making sure that that's not causing or contributing to your symptoms. But one way or another, from my experience, people will try these different routes and still hurt more than they like and function less than they like. So maybe it's time for something different or maybe a new approach is needed. And that's where I'd like to share this idea, what I call the body partnership model. This is something that I've been building for a long time, just not really putting a name to it until now. It's a I'll just read it here. A therapeutic model for better understanding, using, and relating to your body that encourages allyship, friendship, compassion as you work with and not against your body. So this idea, I would say, in many cases, goes in direct opposition to the way that our healthcare system encourages us, or maybe even popular culture encourages us to view or relate to our bodies. We tend to look at our bodies as something that's getting in the way or letting us down. That can foster a very begrudging and resentful relationship with one's body, which I'll just say doesn't help. And not just that, I feel like it doesn't align with what I think is more wholesome in terms of how you relate or how you work with your body. So instead, this approach is more about listening to your body and learning to understand what it's saying, understand on an intellectual level. So I teach people about how pain works and that there's a lot of things that contribute to it, but also what does it mean for you on a personal level? So that kind of understanding, that personal awareness is important. And then from that higher level of or deeper level of understanding and attunement with one's body, being able to make choices to be more responsive. So, body responsiveness or responding wisely to one's body in what it is that you're doing with your body or how you're trying to use your body. So, when it comes to pain, and specifically, you're you could go about this a few different ways, but I encourage folks to start with calming things down first. And we'll break down our workshop today into two key phases: calming things down and building things up, building the body up. So we want to try to calm things down first, but then as we build things up, learn to do so without flaring up pain, or in other words, not waking the bear. I'll introduce you to the bear here in just a moment. But what's really fundamental or core to this body partnership idea is that why and how matter more than what. And what that means is there are lots of ways to try to build your body up or do things that are good or wholesome or healthy for your body, but why you're doing it and how you go about doing it matters more than what you do. I'll give you some more examples of what this looks like, particularly when we get into building the body up. But just for starters, when it comes to your why, that my hope is that you're approaching whatever it is you're doing with your body from a perspective of better understanding first. So we'll talk about how pain works here in a bit and what you're actually trying to accomplish with whatever it is you're setting out to do. If you're trying to calm things down or build things up, that really shapes then how you go about doing that thing. And then we'll talk about specifics on how to yeah, how to calm things down and how to build things up without flaring up your pain. So I want to introduce you to our companion on this journey, the bear. I've been working, like I said, for many years in chronic pain, and this metaphor is the one that seems to be the most popular. And I'll explain what it means. When a person starts some kind of exercise routine, whether that's physical therapy or they try to go to the gym or do things even in their daily lives around the house or in the yard. And when you push your body hard enough to the point where it flares up your symptoms either that day or maybe the next day, this is what I call waking the bear. And from my perspective, my thought is, what's the point? What's the point in going through a program to build strength or endurance if along the way it just causes you to hurt more? So instead, the way that I encourage folks to start their journey in being a better partner to their body is to calm the bear. So we'll establish some tools here today and some strategies to help calm things down. But then, if you do want to restore meaningful activities in your life and build more robustness in your body, it's actually safe to poke the bear a little, which means pushing into some discomfort or pain, but not to the point where it flares up your pain. So you're not avoiding things that hurt, but you're not pushing through either. This is that middle way I like to talk about. So this applies to movements, exercises, daily activities, and if one sticks with this bear strategy and keeps the bear in mind, I think it can go a really long way to help calm things down and build things back up again from a more again partnering relationship with your body. And at the end of the day, the bear is really more about fear than it is about pain. And I'd be happy to speak more about that here. So before we go any further, I'm just gonna give everyone a chance to maybe digest some of that, and then I'll go back to this gallery view. Does anyone have any thoughts or questions so far about this idea about the bear or about body partnership?
I have a question.
Yeah. Hi, Michelle.
Hi, thank you. This is super helpful. I am so curious about when the pain will come afterwards, when it's the next day you can't walk. But during it felt really great.
Yeah. Yeah, so I imagine many of you have experienced something like that before. I like to call these delayed onset bear sightings. The bear doesn't show up right then and there, but it shows up later. So how do you navigate that? It sounds like is the question, and it's not easy to be fair, but there are some ways that I would encourage folks to do so. First, I think it's important to kind of understand what is and what isn't happening when the bear wakes up. So, for example, if you in this example, if you do something and it feels good while you're doing it, but it hurts more later, maybe that day or the next day, one thing that I like to ask folks is if you sprain your ankle, is it going to hurt then or is it going to hurt later? And it's going to hurt then and there. If you strain a muscle, if you tear something, are you going to feel it then? And the answer is yes. And same thing with anything broken. If you hurt more later and you didn't hurt at the time of the activity, the likelihood that what you did caused new damage or injury is very low. That doesn't mean that you should just ignore the pain or this flare up that you're experiencing, but it just means that let's start with establishing a little sense of safety that perhaps you're hurting, but you haven't harmed yourself. You might be sore, but you're still sensitive or I'm sorry, but you're safe and your body's just maybe a bit more sensitive to activity. So that's how I might start approaching these experiences or these episodes. But then if it's still, if that doesn't help, you may need to do a bit more to kind of keep track. And one way of doing that is to keep a journal, like an activity journal. And at a minimum, if you were to do so, I would just suggest what did you do that day and how did you feel? And then keeping up with that over time can give you a sense of, am I pushing too hard too often? Am I pushing too hard at on a specific instance or a specific day? And then from that information, you can reflect back and then maybe make adjustments next time around. So, anyways, I'll stop there. Michelle, does that help at all?
Yeah, that's great. Thank you.
Okay, thank you for your question.
Jen has a question as well.
Yeah. Hi, Jen.
Hi, thanks, Jason. I with this analogy, I feel like my bear is a light sleeper and very sensitized to everything. And what I'm noticing is what this spurred me to thinking is it's like my nervous system is so flared that anything is gonna mess with the bear. Meaning there are some safe things I can do, like walking, but if it's like, you know, other things and I move my body the wrong way, like I don't really have like, oh, I can ease into that and just do a minute of it. It's like if I do it, even for a second, it's really painful. So I don't really ease into it. So then I just stay to my safe things. So avoiding a ton of things. So I didn't know if you could speak to that at all, but that's my experience.
Absolutely. Yeah, that's thank you for that. And I'm sorry that it's been a struggle in that way, because I imagine that's really limiting in being able to do things that you care about if you're really limited to just one or a couple of things that you can do without hurting. So I just want to start and preface by saying it sounds like a healthcare provider would be someone who could walk you through some of these things would be ideal. Um, so everything I'm sharing is really just general information. So I hope you can loosely apply it to what your specific challenges and needs are. But what I tend to do is I start with folks learning how to do really, really gentle motions, just to help explore movement in very controlled and compassionate ways is how I might frame that. So I teach these exercises I call looseners. And looseners aren't the same as stretches. They're not designed to build flexibility or strength or endurance. They're just designed to help explore a little bit of movement through poke-free range of motions that don't cause more pain. And even if that's just an inch or two, that's where we start. And that both helps explore the motion and explore movement again, and hopefully reduce a little bit of tension that might build in areas that hurt. We'll talk about tension and muscle guarding a little later. And then, assuming that we've made some headway with these sorts of things, we've explored a little bit of movement, we've loosened things up, maybe calmed things down a little, then we might start approaching activities that have otherwise been sensitive, things that would flare up your pain. And it sounds like even when you try just a little bit of it, that's too much, unfortunately. So if that's the case and we run into that issue, there are other ways to work with that. And this might sound kind of strange, and I'll just throw it out there. There are imagery activities that I take people through. So if, let's say, bending over is something that they need to do on a regular basis, and who doesn't? I mean, we all have to pick up our groceries off the floor, or a small child, or whatever. If you were to go do something like that, some kind of bending activity, you're likely going to experience another bear sighting. So instead, what I might ask a person to do is imagine doing the motion. And believe it or not, you use the same parts of your brain for imagining movement as actually doing the movement. And for many, I've used imagery as a stepping stone towards very small, great versions of the desired activity. And then once we get through to a point where a person can imagine doing the motion without causing without poking the bear, then we might start into those gradual progressions of motion. So those are just a few ideas. I hope that gives you a little bit of hope for maybe a new direction. What do you think, Jen?
Yeah, thank you. I think I've heard something about the imagery thing, and thank you for the reminder on that. That's really great that I can feel like I'm making progress and not just stopped. Thank you for the modification.
Absolutely. Yeah, you're welcome.
Jason, would you
Does
say that
anyone-
that's even like what poking the bear is, right? Like that's that most minimal, like minimal thing you can do without pain. Visualization is included in that, and then we work up from there.
Absolutely. Absolutely. And, you know, for those who are interested, I'm always excited to share and help people understand how pain works and why something like imagery would even make a difference, because you're literally not moving, you're literally not doing anything. And it has a lot to do with your nervous system, and it has a lot to do with sensitivity. But yeah, when you're poking the bear, like I said earlier in that last slide, that's really what we're talking about is fear, and not just, consciously like, oh, I'm afraid to move. And I find that's often not true. But a lot of times the nervous system is extra nervous about certain movement or certain body parts being moved. So what we're doing is we're exposing or introducing movements that have been previously deemed unsafe or threatening, and that kind of poking can go a long way to reduce the reactivity in the system. So, anyways, I just felt that sometimes adding a little extra explanation can be helpful. Thanks, Destiny. Does anyone else have any questions before we move on?
I'm wondering if we want to answer these now, or are you going to hold off until the end we can do Q&A throughout if it feels good for you, Jason, or we can hold off to the end. Do you have a preference?
So I have built in like breaking points for question and answer. So I think if it's not a question directly related to the bear or the body partnership model, then I'm going to ask them, maybe we hold the questions until maybe another time.
Yeah, that sounds good. So there's two questions then. You kind of had mentioned, so this one was, what does it say or mean about the body when you actually roll or sprain your ankle and it doesn't hurt in the moment, but then it does hurt later? And then the other one is about using visual imagery in the nervous system. And I think that one we might even start to practice that in the support group if you're staying after, because that is something that I often do with clients too. So we can just maybe go into the bear one about what if you roll your ankle and it doesn't really hurt now, but it does hurt later. What does it mean?
Yeah, so that's a good question. It does happen. It's much more rare that sort of event might occur. From my experience, at least. I mean, anytime I've had an injury like that, I've known about it right then and there. Sometimes the context of the situation, often actually, will impact what you experience. So I use this example. It's interesting that this was the question about the ankle sprain, because I use the example, if you walked across the street and you sprained your ankle, would that hurt? And again, most of the time, the answer is yes. But if you walk across the street and you sprain your ankle and there's a bus flying at you out of the corner of your eye, in that moment in time, you probably won't experience a whole lot of ankle pain. And we can talk about why. That's a example of having an injury but not having pain. And there are a lot of things that are going on maybe on a neurophysiologic level that I think are interesting, but let's just suffice it to say that in certain scenarios, if you have an injury and you don't know about it right then and there, like a new ankle sprain, and again, a new ankle sprain is really different than maybe an ankle that's been chronically hurting or has had a history of hurting that starts to hurt again. Say that if you do have a new ankle injury, and you don't feel it then and there, your brain can do some really groovy things to decide or discern what's the most important thing you should know about in a given moment. And this is why you might hear these examples of like combat veterans or maybe even athletes who have these severe injuries that happen during the game or during some kind of battle, but won't feel anything until later. And this has a lot to do with our endogenous opioid system or our pain modulation system. And just suffice it to say, we all produce pain medication. They're called endorphins. And in certain scenarios, our brains will release these chemicals to modulate the signals coming from our bodies when we've had an injury. And it does that if it has decided on our behalfs that what it would rather us focus on is a higher priority. So I think that's the best way I can explain that scenario right now without getting too much into the weeds about it. So I don't know if that helps any. And what was the second question, Destiny?
The second question is more about working specifically with visual imagery and the nervous system. And it might be wanting a neuroscience explanation, but I think we will practice that as well.
Yeah. I would love to explain that, but there's a lot of other interesting, juicy stuff that I want to talk about. So if we have time at the end, I would love to maybe go into, what's going on with imagery that would make that difference. So if it's okay, I'm going to go back to screen share and we'll move on.
You are still actually screen sharing, Jason. I don't know if you can see. I can still see your PowerPoint and you.
I can't see my PowerPoint without switching the tabs.
Okay.
That's okay. It's nice to see your faces intermittently, but when I'm presenting, I won't be able to see your faces, unfortunately. All right. So there's our friend the bear. So phase 1 of our project, let's see if I can get it going. I was on a little bit of a delay there. Sorry, let me back up. Okay, phase 1, calming things down. So this body partnership project with with a person who's experiencing chronic pain, who's wanting to calm their pain. Phase 1, I would encourage BD calming the bear or calming the body down. So what do we actually mean by calming the bear? So at the risk of combining too many metaphors all at once, I'm going to introduce you to your second metaphor for today, which is the alarm. Pain is an alarm, like a car alarm or house alarm, smoke alarm, some kind of an alarm that goes off typically when you have an injury. So pain is an alarm. And let's say, for example, you were to step on a nail. Question would be, would that hurt? And the answer is, well, duh, Jason, of course that would hurt. So would you want to know about it? Yes. And what would happen is if you step on a nail, there's going to be signals that come from your foot and they travel up to your brain. And that's when you know that you have a foot injury that needs to be cared for. So visually, if you can see this image here with the alarm to the right of the person's foot, things are going normally. You step on the nail and boom, the electrical activity for that foot spikes. And when it crosses that threshold, the foot sends the brain that message, and then your brain then creates the experience of pain so that you can know to take care of the foot. And typically with an injury, once you've addressed the key issue, like a nail sticking in your foot, there will be an inevitable healing process. All injuries do heal. And that's a loaded statement. We can talk about that, but let's say in this example, you step on the nail, the inflammation and swelling will then arrive. And for a period of time, that foot will be sensitive. It's going to hurt to put pressure on it, to put weight on it, to move it. But like I said, as the injury heals and the inflammation and swelling subside and the scar tissue forms, etc., the sensitivity on that alarm will dissipate. So it'll be more sensitive for a bit of time. And then after however long it takes to heal, the sensitivity will go back to roughly the place it was before the injury so that you can go back to walking, moving, standing, lifting, and not having foot pain anymore. This would be great if all pain worked this way, but unfortunately with chronic pain, it doesn't. What happens is the alarm doesn't calm down. It remains extra sensitive. And what that means is it doesn't take as much movement, standing, sitting, walking, changes in the weather, increased stress, decreased sleep to set that alarm off. Or if it's already going off, like many people experience where they're hurting all the time, it doesn't take as much to increase or turn the volume up on the pain or wake the bear, so to speak. So what we call that is a sensitive alarm system, or the technical term is sensitization. So sensitized nervous system is what we're talking about here. And I'll make the claim that at the core of all chronic pain is a sensitive alarm system. So if you look at the left here on the left hand side of the screen, you see a body with this huge network of nerves. You have 45 miles of nerves that connect back to a spinal cord and brain. And this is your living, breathing alarm system. So when we're talking about calming the bear, what we're really talking about is calming a sensitive nervous system. And there are a lot of ways to do this. First, I think it matters to understand what contributes to a sensitive alarm. And what's core or key to understand about that is that pain is not black or white. And what I mean by that is pain is gray, or there's always more than one thing that contributes to any pain ever. So I can give you lots of examples, but let's just say that there are a lot of contributing factors to one's pain. And I think about it sometimes like a pie graph. And if you look at that pie graph, there are going to be many slices in there. My goal is to help folks recognize where they have the most agency over the things that are contributing to their sensitivity, and then help them engage in the activities or take on the responsibility or role of addressing those sensitizing factors. So this is another pretty big piece of learning for a lot of folks. It's a very different way of thinking or learning or thinking about their pain. I'm going to let this be another real quick breaking point for any questions. So does anyone have a question about this idea about a sensitive nervous system or a sensitive alarm?
Hey, Jason, this is Shay. I'm with my mom, Vicky here. But I don't believe we're on camera. I do have a question about the pie chart you just mentioned about the different factors to pain. Do you have a visual, or can you explain that a little bit more about maybe some of those factors?
Absolutely. So I did not include the visual for this workshop just because it really does start to get us into the weeds a bit. But let me just give you a few examples, because we're going to look at a few of these examples together today. But there are a lot of things that contribute to pain. I think let's start with where most folks arrive or where they're coming from. Most people are led to believe by orthopedists or physical therapists or different healthcare providers over time that, well, the reason why they hurt is because of all the degeneration in their body. So maybe they've experienced chronic back pain or hip pain or shoulder pain. And the explanation for that pain is that you have arthritis or certain degenerative changes that have occurred in that body part. And well, there's nothing we can really do about that. We can attempt to address it with surgery. And that's the kind of, again, black or white explanation that a person might get for their pain. And what I'm not going to say is that we're going to just let go of that explanation. We're just going to put that as a slice of the pie. But let's look at the other things that might contribute. So for example, one thing that might not be so obvious is sleep. If you're not getting good quality sleep on a regular basis, which isn't easy to do either, that might also keep your nervous system more sensitive. So that adds one little shade or layer of gray to the equation. I'm about to talk about a real important starting point for a lot of my patients, which is muscular tension and guarding, and how tension in and of itself can increase sensitivity to parts of the body that hurt persistently. We talked earlier already a little bit about the bear. We'll go into more detail about that. But if you're doing activities that are constantly activating that alarm and flaring up the pain or waking the bear, that can also keep the alarm more sensitive. So these are just a few pieces that might contribute to one's pain pie graph. What you can't do is I can't put anyone's body in a time machine so all those arthritic changes go away. But we can work on sleep. We can work on activity modification. We can learn to relax our bodies. So there's just a few examples.
Thank you very much. That's super helpful. She actually just had total knee replacement yesterday. So
Oh, wow.
what you're talking about is very relevant.
Good. I'm glad to hear that. And yeah, I wish her well on her recovery. That's a pretty
Thank you.
significant surgery, and the rehabilitation can be very tricky. So yeah, best wishes.
Thank you.
Yeah, you're welcome. Does anyone else have a question about the alarm or the pain pie graph or anything else that I just mentioned?
Hey there. My name is Amy. My wife and I are both logged in, but we're using our laptop as a central viewing point here.
Okay.
So for me, like, I don't have like, I guess like, I don't know if I have like an alarm, but for me, it's like scheduled sleep. Like, if I'm like unplanned sleep for me, I feel less painful when I wake up rather than like, okay, it's bedtime, it's time to go to sleep. As soon as I open my eyes, it's like excruciating pain throughout my entire body.
Mm.
And I've had chronic pain for over 20 years now, and multiple injuries and surgeries. And from my basically my neck to my hips and my knees, my ankles, I've just got a whole host of conditions. And so I find that the alarm for me is more so like, okay, it's time to go to bed. I am hesitant to go to sleep, and then therefore I don't get good sleep because I know as soon as I wake up, I'm going to be in excruciating pain. But like if I just randomly fall asleep or take like a nap or something like that, I find that I have less pain with those unscheduled or like random sleeps.
Yeah. Would it be okay if I just make a few comments about that?
Yeah, sure.
Yeah. So that's also unfortunately not an unfamiliar thing to me. It's something I hear about a lot when working with people who experience chronic pain is sleep dysregulation and sleep challenges that they might have. You know, there's a whole body of research about science, about sleep and sleep science these days that really can be helpful in having like a general target for what optimal sleep is for one's overall health and well-being. But with that said, it's really hard to sleep if you know that A, that you're going to feel really terrible afterwards, or B, that you can't sleep because you hurt, and then you just get whatever sleep you can. So these unplanned sleep patterns or sleep episodes again it's a familiar area for me. So we may not start there for somebody who's just getting by with their sleep program or sleep patterns as they currently stand, but we may start just doing a couple things to work with that. So for example, if you know that when you plan your sleep and you know that I need sleep, I want to sleep, but I'm going to pay for it if I do because that's what happens every time. Well, I might just encourage a few different strategies before going to bed. So maybe some breathing and relaxation or meditation or something like that before going to bed. And these are sorts of things that might take time before they make the difference that you're looking for. I'm not going to say that if you don't restore uh, quote unquote optimal sleep, like 7 to 9 hours every day, no naps, like what the sleep hygiene literature might say. If you don't do that, then you're gonna suffer the consequences. I won't go that far, but it would still be worthwhile to experiment with just changing a few variables here and there, and just see if that helps improve your sleep quality and quantity, and then leads to a change or hopefully reduction in symptoms. Um, and also we know that sleep affects every aspect of your health. So not getting good quality sleep consistently will affect your health in lots of ways. So again, that's probably all that I could say right now with getting into the specifics of your situation. But I hope some of that gives you, I don't know, maybe a few ideas as to how to maybe move forward and maybe trying a few things out just to try to improve or polish up your sleep a little.
Yeah, I've tried. I used to attend a lot of chronic pain meetings through the U.S. Pain Foundation, and like I was like every day in a meeting, just trying to get by and get the tools and resources. So I learned a lot from that. And what I used to do is like box breathing, or like I would try to meditate, but then really just focus on my breath work and
Mhm.
just like basically drown out like my thoughts. And then um, I did have another thing that I was going to say, but I forgot. But yeah, I've tried a lot of things, and I just feel like for me, it's like I'm not afraid to go to sleep because I know that I'm going to sleep. It might be interrupted sleep, but I just know what's going to happen when I wake up. So I enjoy my sporadic sleep better than I enjoy my nighttime sleep.
Gotcha. I
But
appreciate it. Yeah, you're welcome. And I hope you find some better results with your sleep in the future. And
thank you.
we can look at some other things too. Okay. Does anyone else have any thoughts or questions about the alarm, or would it be okay if we move forward? Okay.
I wanted to add to, like with the alarm, Jason, maybe speaking a little bit to, with all those different factors that contribute to increased pain, do you agree that like when something happens and because of our already heightened sensitivity system, it is kind of like, I hate to use this term because I don't want it to be, it's kind of almost kind of like a new injury, where like lack of sleep is like a new injury. Not injury meaning you're broken and can't fix it, but it's a new, like, injury is the wrong word, like a new thing that adds to the sensitivity. And then there's a lot of mental work that has to be done to like calm this anxiety down around it because there is physically something happening that's uncomfortable. Is that kind of how you approach it too?
Yeah. So I think it's a difficult, and I hope I'm responding to your point well. It's difficult for me sometimes to strike a balance between offering up explanations for what might be driving a person's sensitivity
Mhm.
and then unintentionally elevating their threat or sense of danger in relationship to that new thing. It's like there's one more thing that is not right about my system, not right about my health that I have to fix or correct. And that then unintentionally can further elevate the sensitivity in their system because it heightens their sense of anxiety or one more thing that they have to, to contend with to feel better. So I want to offer areas or territory for a person to explore that might provide some relief, but also let people know that it's not a matter of doing 15 different things for you to feel better. But here's one place that you might start, and it may or may not make the difference that's needed. And again, it's just one of many areas, and it's not even, I would say, the highest priority when it comes to physical pain. It's just one area that we might want to put a little bit of energy into.
Yeah,
Does
that's
that
great.
help, Destiny?
That's great. Yeah.
Okay. All right. I'm gonna go back to the PowerPoint. Okay. So we've talked about the bear, and now we've talked about the alarm, and now your third and hopefully final metaphor for today is one of my other favorites, and that is the fist. If it'll pop up, the fist. So what this means is if you have an injury, let's say you sprain your ankle, like we said before, well, I hope your brain will tell the muscles in that part of your body and around it to tighten up for a bit of time. And that is a very normal, natural reflex or reaction in our system to help brace and protect the area, preventing it from getting worse and allowing it for it to heal. So what happens from there is temporarily the alarm will be sensitive and the fist will be tight and the body will be more guarded in that area. But again, as injuries heal and if the alarm starts to calm, what you'll notice is that more often than not, that the body, as the pain subsides and the injury heals, you'll go back to walking more symmetrically. So that's great. But what happens when pain becomes persistent or chronic? Well, you get persistent or chronic tension or muscle contractions, i.e., the fist. So the fist is a metaphor for what's called co-contraction. And co-contraction is where you have muscle groups that would normally do opposite motions, contracting at the same time, bracing from all angles. So if it's your shoulder, for example, the muscles that lift it forward and backward and rotate it out and rotate it in all contract together. And over time, the brain gets better and better at activating those muscles because the muscles don't contract themselves. The brain is responsible for that. So if you have a fist that's getting made in body parts that hurt all the time, whether that's your neck or your back or a variety of areas, what's happening is your brain is keeping these areas under a persistent state of protection and guarding. And I call this protective motor patterns. This is going to be made worse by things like breath holding habits, which We all hold our breath from time to time. I like to remind people that it's a very human thing to do. But when there's more breath holding, there tends to be more stress and tension in the system. And that tension is like walking around making a fist all day. So the next question is, if it makes sense to you that you would want to protect and guard an area that's hurt or injured, but then over time, it should, dissipate and the body should go back to moving normally. If you have a fist that's getting made, let's just say literally, if you make a fist all day long, how's your hand going to feel? And the answer is not great. It's going to feel tired. It's going to feel weak. If someone asks you to give you a firm handshake at the end of the day with that same hand, it's going to be kind of limp, and you won't be able to provide or produce much force. You'll also notice tension. The fist will create more tightness or stiffness in the area. And on top of all that, it's going to feel more uncomfortable. It's going to feel more sore, painful, cramp, maybe even numb. So one of the first claims that I make to folks who I work with from the very beginning is that your body is making fists around body parts that hurt all the time, and often more so than you're even aware of. But the good news is, and this is, I think, made evident by one of the more common medications that are prescribed for patients, which are muscle relaxers. Why would a clinician prescribe a medication to relax your muscles for a pain condition? And the answer is because something about tension makes pain worse. So relaxation can make things feel better. And I like to remind people that you are a muscle relaxer, and I just don't know that you've been taught how to effectively relax your body. So I teach motions, like I mentioned earlier, called looseners, which are gentle motions to learn how to move and relax at the same time. I'll also use some hands-on or manual therapy to help people learn to let go and allow their body to be moved in a very careful and gradual pace. And just general relaxation techniques can go a long way to start relaxing one's body, but also relaxing one's nervous system, because not only is it true that specific areas of pain will be specifically guarded, or the brain will want to keep those areas under a higher state of protection. Well, if the whole system, or the person that is, feels more under threat by life, whatever might be going on in a person's life, what's going on inside of that person, what's been going on inside of that person for a very, very long time, perhaps, or what's going on outside in the world. Well, that heightened stress or fear in the system will also create more diffuse or global tension in their body. And that also contributes to the pain. So one of the first steps to unclenching the fist is to learn different breathing techniques. And one of our participants, I'm sorry, her name escapes me, mentioned box breathing. That's one of many ways to go about it. I have my own breathing technique that I'd like to take you through right now, and it's called the Deep and Easies. So I'll go back to gallery mode, and I'm going to invite everyone to participate in this practice. You don't have to. You can just listen along if you'd like. So this will take about 8 minutes or so, and then we'll have a little time for chatting afterwards if you have any thoughts or questions about what you just experienced. So I invite you all to find a position wherever you're sitting or lying down that's going to be supportive for this practice, one where you feel relatively relaxed and comfortable, but also awake and alert. And then if you feel comfortable with doing so, you can close your eyes, or maybe if that doesn't feel safe, you might allow your gaze to soften. And straight away, I invite you just to simply notice what it's like to be in a body that's sitting or lying down. You might just take a moment to feel where your body's making contact with your support surface. So if you're sitting where your butt is making contact with the cushion, or your back against the backrest, just see if you can give your weight over to this support a little bit more each moment. Allow it to hold you. You might feel your feet on the floor and allow your legs to relax. Notice how you've positioned your arms and hands and allow them to also be supported as you relax and soften. And just take a moment to just feel yourself sitting or lying down and breathing. And you might notice that you are already breathing, that you don't actually have to pay attention or do anything for your body to continue to breathe itself. So I invite you just to continue allowing the body to breathe for you as you observe. You might feel the breath as the chest rises and falls, or as the belly swells on the inhale and subsides on the exhale. Or you might notice the air flowing in and out of the nostrils. Stay in one of these areas as you feel the body breathe in, feel the body breathe out. Just allowing yourself to become more present and connected to something that feels hopefully safe and comfortable, like the breath. Something that brings you home to your body for the time being. And now I invite you to turn your attention to an area of discomfort or pain. And you may not want to pick an area that's already flared up right now. If one exists that feels uncomfortable, that you feel safe and comfortable paying attention to for just a moment, you might start there. And just take a moment to notice what's present. See if you can discern the exact location of this discomfort or pain, how big the area is, the shape it makes. Notice if this area feels warmer or cooler than the rest of your body, harder or softer, heavier or lighter. Notice if the sensations in this area stay the same from moment to moment, or if they change. And lastly, I invite you to just simply notice your relationship to this sensation or part of your body. In other words, you have the sensations that you just explored, and then you have how you feel about it. And there's a good chance that the relationship isn't warm and cuddly, nor is it indifferent or neutral. You might notice resistance. You might notice something inside that's wanting to say no to the pain. So I invite you to just say yes to the part of you that's saying no. Something inside that feels frustrated, disappointed, worried, concerned, all the above about this pain. And you might just let this part of you know that you see it and you get it. You understand why it feels that way. Okay, so now we're going to begin the breathing. And I invite you to start with a slow, deep inhale, followed by an easy, restful exhale. Deeply in, easy out. Continue on in this pattern for the next few minutes. And notice as you breathe in, what it feels like for the lungs to expand and fill with air. And as you exhale, see if you can allow the body to breathe out all on its own, allowing it to soften and ease a little tension each exhale. Deeply in, easy out. You may start relaxing some specific areas that might feel already noticeable to you. Maybe you notice some tension in your brow or tightness in your jaw. Deeply in, easy out. Letting go of this tension wherever you feel it and find it. Letting your hands soften and your feet relax. Deeply in, easy out. Letting your shoulders sink down and away from your ears. Allow your back to to be fully supported by your backrest. Deeply in. Easy out. Now you might start softening areas that are adjacent to those that hurt. So if it's your back, you might relax your hips or your thighs just a little. If it's your neck or shoulders, you might relax your arms and the muscles in your face. Deeply in. Easy out. Just a few more. Feel your body filling with air and feeling it soften just a little more with each exhale. Deeply in. Easy with the breath. Easy with the body. Easy with yourself. May I be easy with myself. And now I invite you to allow your breathing to return to a normal rhythm. And just simply notice what feels new or different inside. And there might not be much to speak of. There might be a lot. We don't want to judge or analyze, just notice. Just notice what's here now. And then when you're ready, feel free to open your eyes. Move around if you need to. Thank you all for allowing me to guide you through that practice. And I wanted to start by saying I'm not expecting anything specific. In fact, I don't want to give anyone the impression that I think that breathing is the answer to all your problems. If I had a breathing technique that took all your pain away, then Jeff Bezos would be tying my shoes. I would be the richest man alive, but that's just not how it works. But maybe you notice something change, something shift, something that might be a little surprising or interesting to you. So does anyone have anything interesting that they noticed that they'd like to share? Did anyone notice anything that was challenging or difficult to be with, perhaps something that was going on inside that was, it's really hard to relax this one area, or I felt a lot of intensity when I paid attention to my pain? Okay, I got a question. Jen, what do you got?
Hi, yeah, and it was in this experience, and then also just in regular life too. Like when you were talking about the fist, I have recently been having some different treatments, including some different medications over the last 5 months, and even I had earlier this week like some energy work that makes my body feel so loose, and then it feels too loose. Like it feels like I can't get my body out, and it feels like I'm just so it's been really like alarming the looseness. And even when we were just doing this exercise, there's one particular spot that really, like when I start relaxing, it feels like I do so much holding my left leg in, because if my leg kind of goes out, it pulls on my knee. And so I felt like, I've been questioning, like, is more loose always better? It seems like I have to have some loose to hold myself in the right place or I'll have pain. So that was kind of my experience, not just in this moment, but recently it's been like, oh, it's too loose and I can't stand. And people are telling me, oh, your body's not used to being loose. So it's just disoriented. But anyway, that was my experience. Thanks.
Thanks, Jen. Is it okay if I speak to that?
Yes, please.
Yeah, that's a pretty common experience for a lot of folks. That, if I relax and let go, I might hurt more, or I might put my body in a position where it's more susceptible to hurting or injury. And that that makes sense on some levels. And I understand why I understand why there might be some concern there. On one hand, I might echo that, yeah, if your body's like this all the time, then not being like this can be very unfamiliar and feel unsafe even. And I understand that. And if you're not pulling that leg in, then you might be using and moving that knee or that body part in a way that's causing it to, poke the bear. So it's like, well, let's go right back to guarding and protecting. And I understand where you're coming from. So what I'm not saying is that you just need to be loosey goosey at all times necessarily, but I do think you can have robustness and strength and stability and not be braced and guarding all the time either. So I guess my point would be, let's see if the loosening and the relaxing helps modulate or reduce some of your symptoms and allow for more freedom and ease with movement to give you a little bit of sense of agency over your pain. But then let's build it up. Let's build up some strength and some stability in that area, not in a way that fosters more bracing and stiffening, because there are consequences to that are not great. It does prevent blood flow from occurring. Um, I didn't go through all the different notes on that last graphic, but I call it the white knuckle effect. If you're making a fist all the time, why do your knuckles turn white? And the answer is it cuts off circulation, which is vital for joint health. It's vital for muscles. It's vital for nerves. So last point is maybe a progressive or gradual approach to relaxing and loosening, and maybe in areas that don't hurt first, to just move with more efficiency and fluidity, and then starting to build some strength in the areas that you're concerned about relaxing too much so that they can be relaxed and still stay strong. I like to make the point that, you take any football player that's not playing this weekend at a whatever level, college or high school, those gentlemen are sitting on the couch somewhere. And I guarantee you that they could probably turn around and lift the couch and put it over their head, but they're not tense. They're not guarded. You can be really strong and relaxed too. In fact, you will move with more fluidity and efficiency if you stay relaxed and strong. So I don't know if that helps any.
Yeah, thank you. That does help. I like even just saying to myself that I can be both. It's so black and white, thinking that yeah. And now also you gave me some understanding for myself, like why was I doing that? Like it's like no wonder. And it makes me feel like more validated and not critiquing on myself so much about it. Thank you.
Yeah, you have a system that loves you so much that it will do whatever it can to keep that body part from being put in a compromised position. What a wonderful system. Maybe it can be dialed back a little, but it's still a system that really cares and wants to protect you.
Thank you.
Yeah, you're welcome. Michelle.
Important.
Oh, I just wanted to share that saying yes to the part of you that is saying no, super helpful. A lot of softening happened after that.
Mm. Yeah, thank you for sharing that. I want to just briefly speak to that because I think that's a really unexpected, powerful moment for people when they notice that there's something in them that's saying no to what they feel in their body. I'm a big believer in parts work. We can talk about that. That's an interesting psychotherapeutic avenue, but we all have parts, I would say. And when we have parts inside that see or experience things in our body and see them as threats, as problems, as dangers, these parts are just trying to protect us. They're just trying to say, hey, this is not okay. And it's saying no and resisting. So some of the guarding is to protect the area, but some of the guarding, some of the fist making is to, why do you make a fist? You might be on the verge of punching somebody. So there might be a part of you inside that feels at odds or even at war with parts of your body. So if you can just take a moment to validate that part of yourself, that part of you is really concerned. We don't get angry in a vacuum. If there's anger, there's fear, there's a threat afoot. And if there's a part of us that's frustrated or angry with our bodies, it's doing so. It feels that way because it sees the pain as a threat or a danger. So yeah, I think sometimes just saying yes to the part that's saying no can help the system ease that now that threat has been understood a bit more clearly, I think. So thank you. Does anyone else have any thoughts or questions about the breathing or anything else?
I think this was I think it might have been sent directly to me by accident, but The question is, Jason and Destiny, could you speak to why you choose to work with people with chronic pain? Let's talk about that at the end towards Q&A. I know I could talk for hours about that. So
As can I, as I would I. So I'll go back to the presentation. I might have to move just a touch faster, but I think this is the territory that I really, really wanted to get to today is basic calming techniques and strategies, and maybe opening up the conversation or opening up the possibility for other things to move forward that we can explore at another time. So back to the presentation. Other ways to calm. So there are a lot of ways to calm or to help calm one's system or alarm. The ones that I would really encourage, let's start with activity modification. So going back to the body partnership idea that you're starting from a place of caring for your body, or at least that's the aim, is to learn how to be a good friend or steward to your body. Well, what that might mean is in the front end, before we start building the body up, we might need to adjust or modify how you do what you're already doing. And that might be pacing your activities. So instead of vacuuming the whole house all at once, you might just vacuum a few rooms at a time. You might notice if you're holding your breath during these activities, which I can almost guarantee you that you probably are, and or making fists in the areas that hurt. So you may want to integrate some breathing and some loosening while moving and while performing certain activities. You may also want to look at your body mechanics, and that is there's an asterisk there because I'm going to say something that many of you might find strange or controversial. There is no such thing as good posture or good body mechanics. And what I mean by that is there's a lot of folks who have been led to believe by, I think, well-intentioned healthcare professionals, particularly PTs, that if you don't move or hold your body in just the right way at all times, you're putting your body in a compromised position. And first of all, there is absolutely no research that supports those notions. But what I am not going to tell you is not to follow some of the suggestions, because a lot of times just moving differently in a way that doesn't cause more pain is a good idea to desensitize that movement or desensitize the activity, but it's not something that you have to stick with forever. So if you sit slouched and it feels better to sit straight, you might want to sit straight for a period of time and then explore movement in both directions. Or conversely, a lot of folks have been led to believe that you have to sit straight and tall at all times, or else you're going to put too much pressure on your discs or some part of your spine, which again, this is a can of worms that we can open at the end if you'd like. But I'm going to give you my blessing as a physical therapist to do what mama told you not to, and that is slouch for a bit. It actually takes a lot of pressure off a person's spine if you try it out. Not always, but more often than not, when you allow your spine, the muscles around it, to soften and relax, you might notice a little bit of relief. So anyways, changing and how you move for a bit of time can be a part of that activity modification. And then also asking for help, delegating. That's a really difficult thing for a lot of the people that I work with. It's hard for them to do, is saying yes to their bodies, which means maybe saying no to an activity and asking for help. We already talked a bit about sleep. There's again, a lot of research and articles out about how to improve your sleep at night. I think it's an important thing to consider. And we can talk about that more later if you'd like. Stress reduction is huge. And there are a lot of ways to reduce stress directly and indirectly. I think indirectly through enjoyable activities and starting to engage in life in ways that maybe have been difficult to even consider, and doing a little bit at a time can maybe help reduce some of the stress that a person might experience from not being as participating or not being as engaged in life as they'd like to. Finding things that are enjoyable or fun or meaningful to a person, I think is really important. Mindfulness meditation is a big thing that I advocate, and I can explain. I would need a whole nother workshop just to explain why I think mindfulness is so important to our overall health and well-being and for pain. I'm a really, really big advocate for self-compassion practices. I have a practice that I give folks on a regular basis that's called Coming Home. And I can tell you about that if we have time at the end, but it's essentially kind of like what we talked about before with saying yes to the part that's saying no. Learning how to give ourselves compassion can sometimes mean learning how to turn inward and acknowledge that there's something inside that's scared or sad or angry or some combination, and that we can offer this part of ourselves a little bit of company, attention, acknowledgement, and ultimately, hopefully, a little love and compassion. And that goes a really long way to reduce stress. Seeing a good therapist. I have a therapist. I think we all need one. And I think that can go a long way. Learning to say no in one's life. That's another, again, big mountain for a lot of folks to climb. Having grace for oneself. I like to kiddingly, but not so kiddingly, remind folks that the number one homework that I give people is to have grace for themselves. And that means to have grace for yourself for not doing your homework, and even having grace for yourself for not having grace for yourself. There might be a part of you inside that is very judgmental and very harsh in its expectations, or harsh in its judgments. That part of you is reading from a script, I would say, that it did not author itself, and learning that it's just trying to protect or help you in a way that it once needed to do. I might be opening a can of worms here, and I apologize, but learning how to have grace for yourself means that when we look at these things going on in ourselves, that there's usually a good explanation for how they came to be, and in giving oneself a little bit of understanding and again, compassion and grace can really go a long way. And then graded exposure. And that's where we get into building the body up. Sometimes to calm the bear, we have to remind the system that it's safe to move. And that means poking the bear a little can, in the long run, help calm things down in the system. So phase 2, building the body. So this is where the bear really gets its, time in the spotlight. So we'll talk about what this means. So what are builders? Builders, so I think about when we're talking about body partnership, and the why and the how matters more than the what. What I mean by that is, why are you doing what you're doing? If you're doing an activity to calm things down, it would probably be ill-advised to poke the bear. You can't really calm the bear if you're poking them. So if you're trying to breathe or relax or loosen and it causes more pain, you may want to consider doing that differently. That's what being a partner to your body means, is to be responsive to what you're feeling. But if you're trying to build the body up, it's okay to poke the bear a little bit. You just don't want to wake them up. So builders are exercises that build the body up, allow it to perform and do things at a higher or higher level, or be able to do things for longer. So this sort of robustness can include building strength, building endurance, improving balance, stretching, and providing more flexibility. Even daily activities and recreational activities can build the body up. So again, your strategy here is going to be based off of your why. You're trying to build the body, and you're trying to do so from a partnership mentality, one that treats the body with respect and kindness, but isn't opposed to challenging it a bit. And then you do so by poking the bear without waking them up. And that requires that attunement and awareness that you can build and develop. There are several handouts that you were given. One was called checking in, and the other one was called body responsiveness. And those really speak to this issue of learning how to listen to your body, understand what it's saying, and then make adjustments to how you then go about using and moving your body. So applied body partnerships. So why and the how matter more than the what. So if you notice that you're poking the bear with an activity or exercise, you have 3 choices. I don't think that there's a fourth. I can't think of a fourth, at least. B, stop, don't do anything more, never look at that activity again. Or C, 3, modify the activity, do it differently. And I hope it's not too subtle, but modify is in big letters here for a reason. My invitation to you is to consider there's always a way to adjust and modify the activity. And that might mean right then and there, or over a course of a set of days or a week, where you just change the frequency, the duration, the time of the day, etc., to modify and adjust what you're doing until you can find a way to do it without waking that bear and keeping that alarm more sensitive. So this is what we would call a load management strategy, or load management program. And this is key and fundamental to, I think, all healthy, wholesome rehabilitation programs. Is looking at your load management is more important than the specific exercises that you're doing. So how you go about it and why you're going about it matter more than the what you're doing. So I'm going to take it off of share, and I can give you some examples of different exercises to build the body up and how you might modify if the bear gets poked. But I'm going to give the room here, the audience, a chance to maybe share any examples that you have or any questions you have about a certain activity or exercise that you want to do or want to perform and not flare up your pain every time. And then we can walk through how you might be a better partner to your body in this activity by, again, making certain modifications so that you're not flaring things up. So anyways, does anyone have a specific exercise or activity that they would like to do or they've tried to do and they've struggled with?
Hi, Jason. I'm
Hey,
John.
John.
I have two activities that I've tried to do that kind of fit into both of these categories of like how the pain manifested. So every time I try to go back to the gym, whether it's like walking really slowly or doing light weights, I have not had great results. So let's say for the like walking on a treadmill, I've realized that like if I walk a lot slower as opposed to like really getting my heart rate up, that has kept my pain level down. And I was able to get to like maybe 15 minutes on the treadmill. But then let's say later on in the day, I'm wiped out and then wiped out the whole next day and the day after that. And the same with weights, where it's like real light workout, not going for like heavy weights, just getting used to the movement again. And then feeling like dizziness and saying, okay, then that's a sign for me maybe to slow down or stop. And then that recovery process for days after usually is enough to like just both spiritually kind of shut me down and also make me scared about going back and doing it again and not really sure how to go back and do it again. And so figuring out like how to keep modifying and putting yourself back in the ring, knowing that pain can, it's a powerful teacher that we're scared. You develop a lot of fear around.
Absolutely.
So those are the two situations that came to mind as you shared this that I've been trying to figure out for some time.
Yeah. Well, those are really great examples, and I'm sorry that it's been a struggle for you. I applaud and celebrate your attempts to stick with it and try to get your body going. It sounds like you are trying to be good to your body, trying to take care of it, try to build it up, but just running into these challenging experiences. So a couple ways, again, I have to be general with my feedback because I think if we were together one-on-one, I might ask a lot more questions and that sort of thing, but I'm just going to provide some general, perspectives on this. So let's just stay with one of those two things. Let's start with the walking with the treadmill.
Yeah.
I invite folks to look at their, the project that they're undergoing with me of being a better partner, kind of like an experiment. And if you're a good scientist, you wouldn't want to mix too many variables at one time. You want to try to control your variables. So you may not want to do more than one new thing at a time. All of this, by the way, to take one step backwards requires something that can be really hard for all of us. At least I can speak for myself, and that's patience. That sometimes it requires patience and a little humility and a little bit of a willingness to stick with it at a low level for a longer duration. So one thing you might look at, one of the first things that I like to tell folks is what I call the 48-hour rule. If you're adding in something new that's exertional, and we've already started with some calming activities, things that are going to help keep your system relatively more calm, you may want to start with every other day with whatever it is you're adding. So if it's walking on the treadmill, you would do it every other day. That way you can have that 48 hours to kind of recognize the degree to which that bout of doing it affected your system. And if it didn't do anything more than poke the bear, and by the way, the bear in this case doesn't sound so much like pain, it'll be more like fatigue and dizziness. So that's also a bear, you might call it. So you may want to just monitor and see, did what I did yesterday or the day before significantly impact my day-to-day life, and what is significant to one person versus another. That's again, that's a more personal question, but you would just want to see, is what I'm doing too much in too short a period of time? Then, okay, if you've solved that, say, okay, every other day, I'm still getting the same thing, Jason, it's still happening. I say, okay, well, maybe we need to stick with a lower dosage. So that would be, instead of 15 minutes, you stick with 10 minutes, but for a little longer. You might do it for another week or two before you add a couple more minutes in to that program. And I would want to stay with a comfortable pace, by the way, just as a general rule. There's not like a specific guideline to support this, except for my own experience, but I recommend folks stick with about 15 minutes of comfortable pace, steady state endurance activity before you start adding more intensity. Because yes, aerobic exercise is the freaking miracle drug. If you could put it in a pill, it would make more money than all the other pills combined. It's that powerful. But what's the point if the aerobic exercise is flaring up your symptoms? And the answer is, you're not being a good partner to your body if you just keep on expecting it to adapt in that way, I think, or at least not a reasonable one. So anyways, I get the want or desire for a lot of folks to push through and just keep on trying, but you may have to be patient in how you progress with that activity. And then also when you add in something else like the strength training, you would follow the same principles or guidelines, but you would just do so with sets and reps and that sort of thing. Maybe do a few less sets or reps for each one, and still have that 48 hours to kind of monitor your body's response. So we're getting close to 12, so I wanted to stop there. John, does that help with your question?
Yeah, thank you. I appreciate it.
Yeah, no problem. So hey, Destiny, I can go past 12 and I don't want to keep anyone else. I do have a few more slides left. So how would you
Yeah.
advise?
Good call. Yeah. So I think, remember, everyone, you will get the recording. So if you have to go, no worries. We've been doing a lot of like talking throughout it. So I consider that kind of that support group feel as well. So if it goes into, if it goes past 12, I think that's fine. I'd like for you to get all the information out if you can. And then just remember, guys, we'll have a support group after the end of this, and we will just do all of that until 1 o'clock.
Okay.
So however long you take into that is fine, is my point.
Okay, good. All right, thanks. Well, then I'm going to go back to the slides, and then we're I think pretty close to the end. There might be one thing or two that I would skip, or well, not skip. I'll just touch on more loosely or shortly, concisely, and hold on to any other questions or thoughts that you have, folks. And at the end, I would love to take any and all thoughts or questions that people have. All right. So to summarize, body partnership is an empowering approach that helps you live more fully and hopefully with less pain if applied with the bear in mind. Our ally, our friend, our companion on this journey. Learning how to treat your body with respect and dignity and compassion is a really important thing. And I think it's something that the body deserves. It doesn't choose to feel how it feels, but it can still feel that way sometimes, like our bodies are really bringing us down, and can create more of that, begrudging relationship with your body. But our bodies don't choose to feel how they feel, in my opinion. So can we start fresh from a new perspective? That doesn't mean a clean slate, because sometimes it means recognizing where parts of us are still saying no to the pain or saying no to the body, but ultimately moving in the direction of a partnership sort of model or approach to how one relates to, uses, and understands their body. Calm things down, build things back up again. You can replace the word things with the S word. I heard that once. I thought that was funny. So calm stuff down, build stuff back up again is a nice way of thinking about how to approach dealing with chronic pain in a more partnering and wholesome way. Our key metaphors, the bear, the alarm, and the fist, I hope that they all made sense and provided some degree of utility for you. And the body brings you home is a message that I encourage folks to think about. In many ways, our bodies are, well, number one, our bodies are always in the present moment. And I think that we're more at home in ourselves when we're in the present. But also sometimes you might notice that your symptoms are worse in certain situations. Maybe it's with certain people, or during certain times of year when maybe there's been some challenges in the past, or maybe loved ones lost. And when your symptoms get worse during these periods of time, it's easy perhaps for some, or based off of their experience in the healthcare system, to then be frustrated with their body, like it's just coming at a terrible time, and that is the body's letting you down, or you know my back is angry with me, or my neck hates me, sort of a thing. I hear this a lot. But you may want to also think that perhaps the body's trying to bring you home to yourself. And what I mean by that is, sometimes when these symptoms get elevated during these specific scenarios, maybe there's something inside that needs your attention or care. Maybe there's something inside that's really feeling hurt, or alone, or scared, or overwhelmed, and needs some attention and compassion. And what I have found is, when folks notice these patterns or correlations, and take the time to turn inward and provide themselves compassion, what do you know? Oftentimes the symptoms will also be reduced. And that's a good way of then opening up the possibility that there's more progress to be had, more agency that you have than maybe you knew before, and that perhaps there's more to your symptoms and your health issue than has been articulated to this point. So our minds like to wander, but our bodies are what bring us home.
I love that.
Thanks. Next steps, we won't have time to do a coaching session, or I was going to do a coaching exercise with a volunteer. If one is interested, I'm going to give you some resources to look into after today's workshop, and maybe we might work together in a class setting, or maybe one-on-one. But coaching is really important. I think it's the missing link in our healthcare system, is helping walk alongside folks on their journey is really, really important. You may have heard the term SMART goal. You can look it up on Google, and here's what it means: specific, measurable, achievable, relevant, and time-bound. If you were to take one thing from today's lesson, and maybe it's not even doing anything, maybe it's just looking into something that you learned about or heard about, I invite you to take the time to write a SMART goal. Just start with some small thing that's just within your sphere of influence, like doing a little bit of research. I'm going to give you, you can check out these deep and easy recordings that I've made. They're on my website, on my YouTube channel. You can check them out, listen to them. Maybe you just start with doing the deep and easies for the next 3 nights before bed, or in the morning to start your day. You might look into sleep activity. You might start getting back to the gym and getting back on the treadmill, to go back to that example, but just do so in a bit of a different manner. So I invite you to maybe take something you learned today, and while the iron's hot, strike. See if we can maybe set a SMART goal for oneself that fits that criteria, that helps move you and helps maybe develop a little bit of momentum moving forward, that you can be a more meaningful player in your own physical experience, and a better partner to your body. And here are those resources. Please come check out my website. It's called it's insightempowers.com. There are videos or interviews on there. One I did with Destiny, which I cherish, practices and other resources. I'm going to add more content to both my website and my YouTube channel in the future. More resources, more educational videos, hopefully more workshops, but be on the lookout for that. Check out my Facebook page and my YouTube channel, like I said about that. I work with folks in the state of Tennessee. It's where I'm licensed, and I can do that in person or virtually. If you want to use your insurance and you're local, it would have to be in person, likely. Not many insurance plans cover virtual PT anymore. But for those who are not local, whether you're in Tennessee or elsewhere, I can work with you as a health coach. And that would be basically doing a lot of the same, almost all the same things that I would as a PT, but the framework for the relationship would be a little different, and there would be some limitations. But as far as the education, the coaching, the insights that I have to share, I think a lot of that can be delivered virtually and be very beneficial. And then there's also a class that I have every Friday. I would love for anyone that's listening to just stop in. The first class is free, and there are free consultations for the PT and coaching that I mentioned. But the class is called Caring for Pain, and there are 3 core components to it. There's a practice that I start off each class with. That's a combination of breathing, relaxation, maybe a little self-compassion and some mindfulness. And we kick things off with that. There's a sharing period where people will have an opportunity to share what brings them to class that day, or maybe I'll give the class a prompt and then they'll respond to that. And then at the end, there's always a piece of education that ties the whole thing together, whatever was discussed during the group discussion, or any specific topics that I had in mind that I felt important to share during the class. So those are the resources I have for you. I hope you look into them. And thank you. I
That
hope
was great, Jason.
each of you take care of your bodies and yourself. And yeah, I'm going to take it off screen share.
Yeah, I always love listening to you talk about this stuff because there's such compassion in it, which I think is what we all need so much. I mean, I think we really I think the medical field just like really discounts how much we need someone who can be in it with us. Especially when, Jason, you think you talked about this on the podcast, like you don't have chronic pain yourself, but you have experience like family wise. And so to have somebody who doesn't understand it, I mean, who doesn't have it, understand it that well, I just think is really, really validating. Yeah. So
Thank you for saying that. Yes. Yeah, I have people in my family, people close to me who experience chronic pain. I've been doing this for a long time. I mean, I get back pain. I have a little back pain right now, and it has nothing to do with the fear about this class going well, this workshop going well. It has nothing to do with that. And it probably will feel better a little later today. But no, I do empathize a great deal and have a lot of compassion for this population. And I've just seen, that this is there's a lot of unmet needs in our healthcare system. And I think there's a lot when it comes to chronic pain. And it's just sad because there's so much to be hopeful about, but not enough people sharing what's out there that's beneficial.
I'm wondering if we can talk a minute for the question around visualization. I had some thoughts around it myself and would love to hear what you have to say about that. Like, I think the question, let me reread it again. And then we can go into whoever wants to stay for the support group. We'll just, I'll stop the recording and we will come on camera for that. And so the question was from Lauren Nicole. Can you please, sorry, I was asking for the PDFs. But from Lauren Nicole, can you please explain more how to work specifically with visual imagery and nervous?
Yeah, absolutely. So that's again, it's an interesting area because it's almost hard to believe that would make a difference at all, that this would have a meaningful impact on actual translating to daily activity or movement. But it makes a lot of sense when you understand how pain works. And then from one's own experience, they can, once you see and feel the benefits of it or experiment with it, you'll understand more clearly why it's important. So essentially, the way that this alarm idea factors into this is that, you have this thing called a nervous system, and your nervous system is designed to detect threats and dangers. And if you've done something, a certain activity enough times that when you do it, it hurts, or every time you do it, there's an anticipation in your system that it will hurt. It's not something that you're thinking about. It's not something that you're doing wrong or that you need to just fix with like positive thinking. But your system has been led to believe that this is not a safe activity for you. And it will then keep that movement from happening, or at least limit your ability to do it by keeping it sensitive, keeping that part of your body sensitive. So again, I don't start with imagery. That's like a sidestep that I'll take if I need to. But if we do need to go down that path, and even the slightest degree of movement can cause more pain, then just imagining the movement activates the same parts of the brain, the motor cortex, for the same activity as if you were to really do it. They did an MRI study, just to give you a little context. They had people in an fMRI, which is a functional MRI, which tells you what's happening in the brain in real time. And they asked folks to, I think, extend their right leg or extend one of their legs, straighten it out. And then they monitored the activity. And what they found, as you would expect, is some activity in the opposite side of their brain, motor cortex. And that activity was right in the area where the responsibility for moving the leg sits. So if you move that leg, you're going to see that part of your brain light up. Interestingly, they had the same folks think about moving that same part of the body, and the same part of the brain lit up. So what that does is it gets the brain exposed to the movement, but not actually going through the movement. And for some, even thinking about movement is also painful. So we would even scale back the visualization. So if, for example, bending over is a really painful activity, but they need to do it on a daily basis, and even imagining doing it is painful. What I've done with folks is I have them imagine bending a third of the way down, but do it from a seated position. Again, all within their own mind. So they're imagining that they're sitting, and they're imagining that they're sliding their hands forward down the fronts of their legs, but not too far, just enough that pokes the bear. Maybe it pushes into a little bit of discomfort, but not enough to keep it more sensitive or wake up any bears. And then they do that, and then I'll pair that with breathing. What I'll also add in, and this is, I like to talk about the juicy parts of this, like, the nuts and bolts part, but there's also a really important emotional part of this. And this goes back to that whole recognizing that there's something inside of us saying no. So what I might ask a person to do before we do any of the movement or imagined movement is to notice if there's something that's already showing up inside that's a bit worried about what's about to happen. Because we talked about it, it's like, we're about to do this. You might notice some anxiety. You might notice some pressure in your chest or a tightening in your throat or a pit in your belly. This is the part of you or something in you that's afraid that this is not a safe thing to do. This is not a safe, or this is a compromising activity that you're about to engage in. So what I would say to that person is not to dismiss it or try to talk it out in that feeling, is to affirm it. Say, yeah, I get it. I understand that you're upset. I understand that you're afraid. So you would actually, again, you'd be talking to yourself essentially, which we do anyways, anytime we think. You would talk to this part of you and say, hey, I see you. I get that you're scared and you're upset. I will listen. I will listen to you. I'll listen to the body, and I will not push. I will be a good friend to you in the body. I'll be a partner. So if you can first affirm it, and then maybe reassure it to some degree that you're going to be a good partner and ally to your body, and that you're going to listen to it, then again, it's almost hard to believe, I would imagine, just doing that, their system calms a little bit, their bodies relax a little bit more. And then we proceed into the imagery. And when that does its job, which it almost always does, then we would actually start practicing small degrees of motion in real life. So does that explain a little bit more clearly what it is that's going on with that?
It's so good. Yeah. It made me think of a lot of us struggle with like if you cancel a lot on friends, they stop inviting you. And so this is that analogy of like, I still want you to invite me. So your body still wants you to invite it to do the thing. But you need the permission and the free from guilt and shame to say no over and over and over and over again. And we still hope that you will continue to invite us because one day we might be able to.
100%. I love that. That's a great analogy. Yeah. Any other thoughts or questions from the chat that were left?
That was it. Everybody said, like, thank you so much. Some people left. Wonderful presentation. Thank you. I'll try out your suggestions. This has been excellent, helpful. So lots of good feedback, Jason.
Yeah, I'm glad to hear that. Does anyone else that's still in the room have any other final thoughts, questions, hateful remarks, anything?
Whoever wants to stay, Jen, I'll have you ask your question, and then I'm gonna stop the recording and we'll start the group.
Okay, great.
Great. I just wanted to say quick on that follow-up where you were affirming and reassuring. And then like if your brain isn't believing that, like if you're just kind of going through that because you know you're supposed to do that, is it still working in the brain, Jason?
Yes, I do believe it is. I think, the old expression, I'm not crazy about it, fake it till you make it, is kind of a thing. But I try not to encourage that unless like it's just a one-off. Like this is the one and only opportunity I have with someone. It's like, yeah, just keep at it. Like this is if the only time you're going to hear this message is right now, stick with it. Just try it on, and eventually it'll feel more comfortable, and you'll start fitting. It'll start feeling it fits. But if I had more time to really tease that apart with a person, I might just get them to meet their system where it's at, and it might need to know that it can express its fears, its doubts, its concerns, its anger without being um what's well, I'm not the right word escapes me, but basically we want to affirm whatever feeling is there. There might be part of you that's like, you know what, I don't care about any of this woo-woo stuff that Jason's talking about. Your body is not safe. It's jacked up in whatever way. Sorry, I don't mean to say that in a way that's
I mean, that's
certainly
what our minds sound like. So I think it's good to acknowledge.
well, part of us might feel that way, and a part of us might feel that way for good reason based off of lots of stuff that they've experienced and lots of bad information likely that they've gotten. So we don't want to say, hey, you're wrong. Stop feeling that way. Stop thinking that way. We're okay. We're going to start moving. There are some approaches out there that kind of take that more heavy handed approach to try to convince your brain something. I'm not a fan of those things. I am a bigger fan of working with where your system's at and meeting it in that way in a much more organic, compassionate, and I think again I use the word wholesome a lot. I feel like it's a more wholesome and responsive way of meeting your system where it's at. There might be a part of you that has very understandable, reasonable doubt based off of all the things, all the imaging tests and all the failed surgeries and all the procedures and all the things, or maybe just all the other things that have befallen a person in their life, that this is just not a good thing, that this is not going to get better. This is not going to feel better, and that you are stuck with this and maybe you deserve it. Like, I don't believe these things, but a part of you might. And I think that we don't want to say no to the part of saying no. We don't want to judge that judge. So learning how to meet that part with acceptance and kindness and compassion and understanding without necessarily subscribing to whatever notions it might be presenting, I think is something that is achievable and a better long-term strategy for how you relate to your body and how you relate to yourself.
Thank you.
You're welcome. Thank you, Jen. That was a great question. All right.
All right.
Thank you all.
Thank you, Jason. All right. So let me stop the recording.